Hello, I'm Ty Mason of the DiabetesCouncil.com, researcher, writer, and I have type 2 diabetes. Today I want to talk about diabetes myths you may have heard. After you watch the video today, I invite you to check out the description box for my new ebook. This is one of the most comprehensive diabetes meal planning books you can find anywhere. It contains diabetes-friendly meals and recipes for different goals such as 800 to 1800 calorie per day meal plans, diabetes meal plans, tips and tricks, and there are also tons of diabetes-friendly recipes for everyone. Now, you have heard many things about diabetes. Some of them are true, and others are, well, in the vernacular of the South, just plain hogwash. Today, I want to dispel some myths about diabetes. Myth number 1, diabetes is caused by eating too much sugar. Fact, diabetes is not caused by eating too much sugar. There are two types of diabetes, type 1 and type 2. Type 1 diabetes occurs when the pancreas completely stops making insulin. Type 2 diabetes, on the other hand, results when the body doesn't produce enough insulin and or is unable to use insulin properly. This is also referred to as insulin resistance. This form of diabetes usually occurs in people who are over age 40, overweight, and have a family history of diabetes, although today it is increasingly occurring in younger people. Myth number 2, diabetes is not that serious of a disease. Fact, diabetes causes more deaths per year than breast cancer and AIDS combined. Having diabetes nearly doubles your chance of having a heart attack. The good news is that good diabetes control can reduce your risk for diabetes complications. Myth number 3, insulin will harm you. Fact, insulin is a lifesaver, but it's also difficult to manage for some people. New and improved insulin does allow for much tighter blood sugar control with lower risk of low or high blood sugar. Testing your blood sugar levels, however, is the only way to know how your treatment plan is working for you. Myth number 4, if you have diabetes, you can't eat starchy foods like bread, potatoes, and pasta. Fact, starchy foods can be a part of a healthy meal plan, but portion size is the key. Whole grains, cereals, pasta, rice, and starchy vegetables like potatoes, yams, peas, and corn can be included in your meals and snacks. In addition to these starchy foods, fruits, beans, milk, yogurt, and sweets are also sources of carbohydrates that you need to count in your meal plan. Myth number 5, taking insulin means you have failed. Now, if you have type 1 diabetes, you must take insulin to survive. Once you've been diagnosed, you need it or you'll die. People with type 2 diabetes may initially be able to manage their diabetes with a combination of healthy eating and physical activity. Many people start on oral diabetes medications when they are first diagnosed, and eventually most people will need to go on insulin. Now, this is because diabetes changes over time. If you have type 2 diabetes, starting insulin doesn't mean you've done a bad job. Just the opposite, in fact. Starting on insulin will help you to better manage your diabetes, which in turn lowers your risk of developing complications. Myth number 6, you can catch diabetes from someone else. No. Now, we don't know exactly why some people develop diabetes. We know diabetes is not contagious. It can't be caught like a cold or flu. There seems to be some genetic link in diabetes, particularly type 2. Lifestyle factors also play a part. But you're not going to catch diabetes by, say, drinking after someone. Myth number 7, people with diabetes are more likely to get colds and other illnesses. That's false. You are no more likely to get a cold or other illness if you have diabetes. However, people with diabetes are advised to get their flu shots. This is because any illness can make diabetes more difficult to control, And many people with diabetes who do get the flu are more likely than others to go on to develop serious complications. Myth number 8. Herbal supplements can cure diabetes. This is false. Chances are you've spotted online ads for supplements and vitamins that promise to eliminate your diabetes. That may explain why people with diabetes are more likely to use dietary supplements and herbal therapies than people without. That's according to the American Diabetes Association. Everyone wants that magic bullet. They think if I take this pill for a couple of weeks, I don't have to worry about anything. But folks, that's not true. Stick with a well-researched medication prescribed by your doctor, and if you'd like to take a supplement in addition to standard medication, you should always consult your healthcare provider first. Myth number 9. If you have diabetes, you can't lead an active lifestyle. Now, this myth is particularly problematic because many long-term studies have shown the positive impact regular physical activity has on lowering blood glucose. Naturally, any physical fitness program needs to be approved by your diabetes care team prior to you starting, but once you settle into a program, being active and healthy with diabetes is absolutely possible and is definitely encouraged. Now, if you have any complications such as heart disease, retinopathy, neuropathy, you need to talk with your healthcare provider before you start any kind of exercise program. You may need special tests to make sure it's safe for you to exercise. Ask your provider to refer you to an exercise physiologist or a qualified exercise trainer for suggestions on types of exercise that are best for you. If you've never been very active, start slow. Walking or even yoga are great ways to ease into an activity program. Myth number 10. Injecting insulin is painful. Now, if you take insulin injections, you know it doesn't have to hurt. You may be doing it wrong. In fact, it really shouldn't hurt. Practice good injection technique and the experience will be virtually painless. If you inject insulin with syringes, then the Joslin Diabetes Center offers this advice. After selecting and cleaning an injection site, firmly but tightly pinch up an area about 2 to 3 inches wide. Inject at a 90-degree angle with the skin is pinched. Leave the needle in while you relax the pinch. Count to 5 slowly. Then remove the needle and do not massage the area after injection. If you use an insulin pen and experience discomfort, you may need to ask your provider or diabetes educator about using a shorter pen needle or needles that are thinner. This can help minimize discomfort and do not require you to pinch up. Myth number 11. Exercising when you have diabetes only increases your chance of experiencing low blood sugar. Now, don't think just because you have diabetes you can skip out on your workout. Exercise is crucial to controlling diabetes, as we've talked about before. If you're on insulin or medication that increases insulin production in the body, then you just have to balance exercise with your medication and diet. Talk to your healthcare provider about creating an exercise program that's right for you and your body. Myth number 12. Diabetes means you'll go blind or lose a limb. Well, now left uncontrolled, diabetes can cause serious damage, including heart disease and stroke, blindness, kidney disease, and possibly a loss of a limb. But the risk can be greatly reduced by keeping blood sugar under control. This is according to Dan Nadeau of the Allen Diabetes Center at the Hoag Hospital in Orange County, California. He says better blood sugar control, the right medication, and smart choices about foods are critical for reducing the risk of complications. Working to achieve ideal weight is another powerful tool to avoid complications. Early detection helps reduce the risk of those complications along with regular eye exams, urine tests, and foot exams. Myth number 13. If you are overweight or obese, you will eventually develop type 2 diabetes. Now that's just false. Being overweight is a risk factor for developing this disease, but other risk factors such as family history, ethnicity, and age also play a role. Unfortunately, too many people disregard the other risk factors for diabetes and think that weight is the only risk. Most overweight people never develop type 2 diabetes, and many people with type 2 are at a normal weight or only moderately overweight. Myth number 14. Diabetes is the same for everyone. Symptoms, dietary approaches, and reactions to various foods all vary individually in type 2 diabetes. Some people have no symptoms until they experience a heart attack. While in the hospital, they find out their sugar is sky high, and they had no idea they had diabetes. Whether or not you exercise can play a significant role in determining your blood sugar after eating a certain food as well. You can give the same number of calories to two different people, and their blood sugar may be different, depending on fitness level and even ethnicity. Keeping a food diary with foods and blood sugar reactions 2 hours after a meal helps to determine an individual's reaction to specific foods. Myth number 15. It's your own fault that you have diabetes. First of all, diabetes isn't anyone's fault. No one knows what causes diabetes. Eating and activity choices can play a role in blood sugar control, but it's not the whole story. Telling someone with diabetes it's their own fault is like telling someone with cancer they caused themselves to get it. Not only is it not true, it's very cruel. Myth number 16. People with diabetes can't eat sweets or chocolate. Well, this isn't true. If eaten as part of a healthy meal plan or combined with exercise, sweets and desserts can be eaten by people with diabetes. They are no more off limits to people with diabetes than they are to people without it. The key to sweets is to have very small portions and save them for special occasions, so you focus on your meal and on more healthy foods. Myth number 17. Insulin is the last treatment for diabetes. False. Insulin is the most effective treatment for type 1 diabetes and sometimes even for type 2. In fact, it's always the first choice for many doctors who have patients because it helps give the body some rest from trying to deal with the lack of production in type 1 or the misuse of insulin in the body, type 2. Finding an insulin routine, whether it includes insulin pens, syringes, or pumps, is an effective way to keep blood glucose level near normal. Now, people often view insulin injections as an inconvenience or painful, and they often look at it as a last resort. The truth is, insulin injections give patients control over their bodies and can be adjusted to fit each individual's unique lifestyle. They are the most practical, convenient, and beneficial option for diabetes patients. Many people use insulin only in times of need, and this debunks the myth that once on insulin, always on insulin. Myth number 18. People with diabetes should eat special diabetic foods. Well, that's just false. A healthy meal plan for people with diabetes is generally the same as a healthy diet plan for anyone. Low in saturated fat and trans fat, moderate in salt and in sugar, with meals based on lean protein, non-starchy vegetables, whole grains, healthy fats, and fruit. You see, foods for diabetes and dietetic foods generally offer no special benefit. Most of them still raise blood glucose levels, are usually more expensive, and can also have a laxative effect if they contain sugar alcohols. Myth number 19. Being out of control is part of diabetes. And we're talking about the blood sugar being out of control, and that's false. New treatments and technology have put the control of managing diabetes directly in the hands of the patient. While most people think it's normal for glucose levels to jump around inconsistently, there are tools that allow doctors to match a treatment plan with each individual's lifestyle. Now, in the past, people with diabetes had to lead regimented lifestyles, making sure they ate at specific times or took insulin shots at regular intervals. Although this is one way of managing the disease, it is not the only way. New methods of treatment allow people to match their insulin around their life instead of the other way around. Insulin does the same work for your body every day, but that doesn't mean you do the same thing every day. Myth number 20. There is a cure for diabetes, but big drug companies won't let go of it because it will cost them too much money. Well, that's not true. Like most everything else in this world, there are those with the conspiracy theories that say things like this. For every disease, someone thinks the government or big drug companies are sitting on a cure. Drug companies are not going to sit by and watch people die of a disease they can cure. Scientists and researchers in this field, and there are many, would never allow that to happen. Studies are being made every day, and strides are being made every day. But as of right now, there is no cure for diabetes. Well, that's my list. Have you heard any other myths you would like us to look at? Just let us know. Don't forget to get my new ebook, like this video, and subscribe to our channel so we can continue to bring you informative videos like this one in the future. Thank you so much for watching. I'm Ty Mason.